I'm Dr. Buchert, Betsy. She's going to call me Betsy through this. And
I'm Katie Brouillette.
And this is the first time we're meeting each other, but we wanted to share this conversation that we were going to talk about because we share some extreme common interest for patients, and I referred to her a lot, even having not met her because another patient told me about her. So we wanted you guys to get this sneak peek at this really important topic that you see behind us on the board. So you go by Katie?
I go by Katie.
Even though you're Sydney Kate.
Yeah.
Okay.
Where did you get that name, by the way?
I don't know.
Oh, okay.
I don't know. It's like how you're in my phone, but you go by Katie.
I go by Katie, yes,
Okay,
yes.
so, and Katie, you are
I'm a physical therapist here in town. I've been a PT for 9 years, and I work for Osteoporosis a couple days a week. And then a couple days a week I do, I just started doing this in January, but it's called Onero, and it's a strength training program for people with osteopenia and osteoporosis. So it's people who want to try to get better with maybe not taking medicine.
What ages of people do you work with?
Right now I have anywhere from 53 to 75.
Okay.
Yeah.
And how old can you go?
When is it too late? As old as you want.
Right? Never.
You can do something, you know?
Right. It's never too late.
Yeah.
And do you ever work with people who have risk factors or are just really concerned and like don't want to get osteopenia?
Actually, yeah, there's one person who doesn't have, any sort of diagnosis yet, but she kind of just wanted to get back into strength training. But yes, I mean, I feel like, most people that age are going to have some other things going on. So, we work around those but the people who have stuck with it have really loved it so far.
How did you learn how to do this?
Well, just being a PT for one, I do that a lot with patients. I feel like it's really empowering to have some of my older patients, especially females who have never done this before, lift a barbell from the floor. It's kind of intimidating at first if you've never done it. But then once they do it and they find out that they can do it and it's not that hard, then it's empowering for them too.
Yeah.
So that, number one, being a PT, and then I found out about Onero through a podcast that I listened to and got certified to do that. So you have to be a PT to become certified in it, and then once you have the certification, they put you on the map, and then people start reaching out to you.
Okay. Where did you go to learn how to do that?
It's their website. Yeah.
Why do you think everybody doesn't do that in PT?
That was my question too.
Yeah.
When I first listened to it, I was like, why is no one doing this? And so I think as of now, I think I'm still the only one in Louisiana, which is kind of crazy. But it started in Australia, so I think it's kind of branching out. She got some interest after that Attia podcast, and
yeah. So I heard about Katie from a patient who loved her so much, and treating women, and then also from being a gynecologist, but also doing the functional integrative medicine work that we do. We're always trying to be proactive and preventative. And so someone told me about her, and they loved her so much. I started referring patients because I just don't feel like there's enough aggressive approach out there, for prevention. And so many people have osteopenia and osteoporosis, and it's just horrible for your health. And then everyone I was referring over there was like giving us this great feedback. So we wanted to officially
finally meet.
Yeah, meet
just
each
met
other.
A few minutes ago, yeah.
Well, I'll tell you a little bit about myself. I've been practicing OB-GYN. I always go by Ben's age, so almost 16 years. And from the get-go, like when I came back home, I trained in Chicago at Northwestern for my residency. And I came back home and I was like, I just really love holistic health, preventative health, and it took me a while, maybe 4 or 5 years to kind of come around to institutional medicine, and I trained in that, and I was like, this is it, this is, and it's gotten so much more popular in the last decade, but I've trained in it, almost 10 years ago now, or about 10 years ago, and eventually came around to opening this practice, which has a pros and cons, and it's really hard to run your own medical practice.
How long has this been here?
About a decade.
Okay.
Yeah, it's almost around 10 years, because it wasn't long after that I had a horrible biking accident and just shattered my arm. Like the bones were broken up, they were coming out of my skin. I thought my career was over. I got plates put in, and I went about my life, but I have scoliosis. I used to be a ballet dancer, so I was always very strong and very active, but over those years of just all the repetitive work of delivering babies, doing surgeries. I was also cycling a ton, but asymmetrically, doing yoga, but asymmetrically, and my scoliotic curve doubled. I was in a ton of pain. I have a lateral ascesis now, all these herniated discs, and I was just going through this awful cycle of like trying to stay active, but a lot of pain and getting weaker. And eventually, through a fascia therapist that I know, I wanted her to come today to meet me. She's wonderful. Her name is Susan, and her practice is called Muscle Manipulators, but she can just feel, you know, people like that, they can touch you and they can feel where the fascia is pulling. And she has helped me so much over the years. And through her and another person, they said, you have to get the plates out. You're never going to get better. I'd been diagnosed with dystonia. I was referred to like Baylor, and I just never stopped because I know that I cannot not be physically active. And so I had to figure out why I was in pain. And a lot of women, a lot of people get into that trap. They have an injury, they get in pain, and they just stop being active. And what my doctors had told me, you know, so I got referred to Baylor. I was getting Botox injected in my right paraspinal muscles. And I was like, what else can I do? And they were like, this is just what you will do for the rest of your life. And then my spine surgeon was like, you're looking at a spinal fusion, you know, like, and I was just like, no. And so I just kept looking and seeking, and one physical therapist so I got the plates out last May.
Oh, wow. Okay.
And I am like a new person,
Really?
Not because it was the metal or the plates, but whatever they were doing to my fascial lines and my spiral lines, and you know what I mean by that, was just destroying my body, my physicality. And one physical therapist I saw that used to be one of my dance teachers back in the day, she's kind of off the wall, she's like gyrotonics and a bunch of stuff. She told me about Egoscue, who does a fascial program. And so that was back in like the fall of last year, maybe 6 months after my plates came out, and I just kept working this. And I got better enough between all the fascial exercises and working with Susan that in his book he says everybody has to strength train, and I knew that. And
so
I was
you've
like,
just come back to strength training in the last year-ish?
The end of March.
Oh, wow. Okay.
Yeah, and I found this trainer who I work with through an acquaintance who is a kinesiology PhD at LSU, and she actually teaches my father-in-law Tai Chi, so that's how we know her. It was like serendipity, like the most amazing set of serendipitous circumstances ever. And I had asked her to train my kids because I have 4 teenage boys, and they're playing sports, and like I'm like, they do crappy stuff with their coaches in the gym. I'm like, oh, you're gonna hurt yourself. So she's been training my boys at the UREC, and I was like, Taylor, I need you to help me too. Like, I have to strength train, but my back is a mess. It's all like, you look at my image and you're like, oh. But even though that's not that important. But she was like, 'cause she had a herniated disc too, and she's a power lifter. And she was told to stop, and she figured it out and didn't, and she's an incredible woman. But she referred me to her trainer who helped her. His name is John. And I drove out to this gym, so this is the end of March. It's off of Choctaw. It's called Atlas Strength. It's a strongman gym. And I go in and I was like,
hello.
I'm a little like ex-ballet dancer. You know what I mean? I'm like so weak. And I tell you, since I started with him, and I've been strength training. Now, granted, I still do my fascial work. I do all this stuff for myself, people. Like, you know, like this is why I'm trying to constantly teach patients. But this element had been just inaccessible for me. But I never stopped. I mean, I would go on like, you know, 10-mile walks because I was like, I have to do something. I'm gonna keep moving. I never stopped moving. I've gotten so much stronger. Like yesterday, I went from like barely being able to do an air squat at the end of March because my hips were so twisted from my spiral lines being all screwball, but he would just stretch my hips, you know, and like very minimal, and I just over and over just do it. And it's not a lot of weight, but I deadlifted 105 pounds yesterday.
That's awesome.
You know, like, and that
great.
was 3 months and a little bit of just being excessively consistent. I see him twice a week. He gives me a workout I do with the UREC once a week. And even when I'm post-call, no matter what I have going on, I make it happen, and I just do it, and like I am not in pain anymore.
I was gonna say, you probably feel so much better.
I'm not in pain. Like I can run up and down the stairs. Like I feel so good, and I'm gonna keep going because my goal.
You can keep up with your boys now.
Well, right, and so 2 of my kids are adopted from Ethiopia.
Oh, wow.
Since they were babies, and they have some living family members, so we go back to visit.
Oh, wow, okay.
And this next summer of 2026, we're going back for the 4th time. And they were like, we want to go to some other countries in Africa. And so we're going to go to Tanzania, and I really want to climb Kilimanjaro. So that's what I'm training
That's your goal?
for. That's my goal. So like a year from
goal.
now,
I
that's
love
where
it.
I expect
Wow.
to
I love it.
be. And I just love life. Like I just love everything and being active. So I have used all of this for myself, and from my personal experience going through all of that, I feel how important it is, and I want everybody to like really have access. And so we've been transitioning our practice to really be more focused on, you know, using the entire, like all the aspects of functional medicine for everybody versus just sort of like rushing through and like nitpicking here and there. That we really want, you know, everybody to be all into the entire holistic part of healing the body. So from your, and that was a lot of long-winded stuff, but I feel like it was I feel like so successful, and I thought I was going to be stuck like that forever.
Yeah,
like I really did.
And
it was so depressing
for so long. Yeah,
for so long. I mean,
in
9
pain.
years.
Yeah,
9 years.
Yeah, and then
now it's just like,
and you're lifting weights and you're pain free, and
yeah, it's amazing. Not 100% pain free, but very, very close, and I expect it to get that way.
Yeah.
So from a muscle standpoint, you know, why do you tell patients that they have to maintain their skeletal muscle?
Well, you know, extremely functional to be able to, you know, do just activities of daily living. You have to have, you know, adequate muscle strength and function. But then kind of along the lines of it's what your practice does for women, especially, you know, after a certain age, you know, muscle mass declines. Well, for men too, but for women it seems to be a quicker rate.
Really right. At perimenopause,
yeah. And bone health declines too. So it's even more important for us to maintain it, and you know, to try to have as much as we can going into that period, and then to maintain it after that.
Yeah. And so, you know, even like for patients, like I'm 46. How old are you?
34.
You're 34. You're so young. That's amazing.
34.
Oh my gosh. So I'm 46 and went through almost a decade, and I used to be strong of like literal just muscle loss because my body was just so messed up. But the effort, and even at my age, and giving attention to all of these things, like very, very detailed, I mean, I feel like I'm just at this point bouncing back. And so it's possible, you know, even for people who haven't been able to take care of themselves or haven't chosen to yet at this perimenopause age, it's still really possible to bounce back and get where you need to be. And I've not done a bone density study ever. I should, but I haven't because I'm just tired of like imaging myself and looking at horrible imaging. So right now I'm like going
do some more strength training and look at it.
Exactly. I feel like I want to like really maximize, you know, what I can do through my lifestyle and my efforts, and maybe in a couple of
then
years
take a look at it.
I'll check it before I'm in like full menopause.
Yeah. So with the Onero program, you know, these people get a diagnosis, they've had a DEXA done, and so that we do some assessments, and then they have their numbers on, you know, day one, and then they strength train for a whole year, and then they do it again.
So
I've only been doing it since January, so we haven't had any
come around.
Yeah.
But you know it works because the research is already there.
Oh yeah.
And so if you're following a pathway,
yeah,
you know,
yeah, it's based off of the Lift More study. Have you heard of that study?
Yeah.
Yeah.
Well, I listened to what's her name?
Belinda Beck.
Yeah, I listened to her speaking, and so then I heard them talking about it. But
yep. So that's what the program is based off of. So.
Yeah. So when you see patients, after you assess sort of their general functionality and like where you need to start, so like for me it was like air squats, you know, but like what do you do?
Or just body weight stuff. You know, I have a trainer bar that's like 15 pounds, and everyone can do that for a deadlift at least. Overhead press, some people it's a little bit tougher, so we can back down on weights. I have dumbbells, kettlebells, things that people can use that aren't as intimidating as a barbell if people want to use that first. But yeah, we could start as, you know, with little as a PVC pipe to, you know, just work on form and see how things look. So
yeah, and I think this is something like I would have never done this without expert guidance, because all my doctors were telling me to be still, basically, which I knew was not what I needed to do, but I was terrified to just go and start. I
And
mean,
mess
I
it
was
up,
doing
yeah.
body weight things, like
Mhm.
I was still doing planks and like
Yeah,
that kind of
core
stuff. But as far as like lifting heavier weights, I was never going to do that without an expert.
And that's what, I think a lot of people need that. But actually, one of my patients told me, one of the ladies that I'm seeing, she said one of her doctors, I guess, told her not to lift anything over 30 pounds, which I feel like is
Oh, people say that all the time.
great. And so she said I was starting to feel old and fragile and weak, and then now she's doing this and she's squatting 60 pounds and she's, lifting more than she's ever lifted, and she's like, I'm feeling young,
Yeah.
So
Yeah. And oddly, I think that some women, and I hear this a little bit, not too much, it's sort of like the aesthetics of like thinness. Thankfully, that's starting to go away.
That's out.
It's totally out, and like all these high schoolers are like powerlifting.
Yeah, strong is
which
in,
is
totally.
Amazing. But there's still some people that like really worry, like, oh, I don't want to
About how
eat
they're
too
gonna
much,
look.
or how am I gonna look, or like.
Don't worry about that. Worry about how you're gonna feel.
And that too, but I don't really think it happens. I think you have to be completely obsessed, probably on some augmentation to like really bulk up as a woman. Like, it certainly is not happening to me. Like my muscles look better, and my trainer was like, do you want to measure your circumferences so we can follow them? And I was like, no.
You're like, I don't care about that.
All I care about is that I'm not in pain and I can do what I want to do,
things.
which I want to do a lot of things.
You can
that
hike.
are like really important to me. I'm going to do that. Yeah, this
Yeah.
summer we're going to. We always hike because I have you ever read The Comfort Crisis?
Mm-mm.
Oh my gosh,
I need to read it. It sounds like I need
the
to read
best book. And I recommend it to patients all the time. It's a fabulous book. I think I heard about it from Peter Attia, and my husband had like come across it. I was like, oh yeah, I listened to it on Audible. But he basically goes through, he's a journalist, and he basically goes through how we have over-comforted ourselves into poor health. And I was already kind of like that. Like, I'm like, it's 110, I'm going to go outside. I'm going to go take
Oh, you already
walk.
did it. Okay.
I kind of was already like that because I knew like I need
That's
to
good for
be
you.
resilient.
Yeah.
You know what I mean?
Yeah.
And with the kids, like we've taken them hiking and backpacking since they were little, and we camp and like try to like immerse into the environment and all of that. And I'll tell you, they are like normal teenagers are like, we're going hiking again, and then we get out there and they love it.
They love it.
You know, but I'm always trying to like push them.
Our son's already been to 4 national parks, so we're like,
Amazing.
we love that.
You're like that too. But this book is amazing, and it really puts all of this efforts into context about what it means for your health if you are like being overly comfortable. So like, is it like easy to strength train? Like, no,
It takes time and effort.
It takes effort.
It's not
but
convenient always.
You just feel so good.
Yeah, it's totally worth it. Yeah.
It is absolutely.
So where are
absolutely
you
worth
going?
it.
You said you're going.
Oh, we're going to the North Cascades. Have you been there?
No.
No. So it's up in North Washington, like on the border. I've been up with Canada. I've been to Glacier a long time ago, pre-injury. But we're going up there, and we're gonna do some backpacking. So I'm excited. I haven't hiked since I've started strength training.
Oh, you're
the
gonna
last
notice
time
a
I
difference.
backpacked was last summer. And I really shouldn't be carrying a heavy pack anymore with the lateral prosthesis, but I did, and I'm like, I'm not going to do that. I'm going to make all of the kids carry the heavy stuff and just carry a light pack. But I'm excited. Do you ever talk to patients about, so everyone's talking about like rucking and like weighted vests, do you ever utilize any of those kinds of things? Or what would you tell someone like me? Because I'm afraid, I know you haven't seen my imaging, but basically all my lumbar vertebrae are herniated to some level, a couple in my C-spine. I have a curve is at like a little over 20 degrees now, so it's not that crazy, and I have a 5 millimeter lateral prosthesis at L3.
So you just don't want to make anything worse.
I don't want to make anything worse. I don't want a spinal fusion. I don't think I should carry heavy backpacks, but I still wonder if I can like, walk, because I walk a lot still. I city
have
hike
a little bit
is what I
on you or
call it,
something.
like 25 pounds or a weighted vest.
I know those are super popular right now.
Yeah. For a reason.
Yeah, and a lot of my patients use them. Actually, one of my patients was saying that she just started like at the lowest amount she could, and I guess hers you can add weight in. So she would get to where maybe on one walk she was having a little tweak in her knee, so she the next time she didn't increase. But so basically she just waited until she didn't have
just followed her
pain.
symptoms.
Yeah. So she just kind of, if it hurts, don't do it. Or just kind of back off a little bit.
Do you think you should worry, like, because a lot of people have structural issues, right? Like whether they have like problems in their hips or their labrum, like all these different things.
Yeah,
There's
probably
like,
a lot of people
I
have
have
stuff and don't even know. Yeah.
Exactly. Like,
Yeah.
I wish I didn't know about this because then I worry about making it worse.
Yeah.
But do you think that it's safe when you're strength training and doing all of this to follow how you feel, and if you're not having pain, that you're probably improving and not getting worse?
That would be, probably the most basic way to make sure that you're okay.
Being safe about it.
Yeah. I would think so. Yeah.
Well, so I wrote a bunch of stuff up here on the board, and I want to just talk a little bit more about them because, one thing that I learned as a provider in learning functional medicine was that it's never just one thing. And when you chase one thing, you don't get very far. That it's always how all of your whole system works together. And so for me personally, and when I have patients that are willing to focus on all of these concepts, it's so much better. That I know, and from what I've learned, learning from other people, other providers that do this kind of thing, not in this city, but other cities.
Are you kind of the only doctor like this here in Baton Rouge?
I mean, I don't know. I function with tunnel vision. So like, I told you I have 4 teenage boys.
Yeah.
I run this. I take,
to look at much else.
6 calls a month with the residents and teach. And then, so I really just I listen to people that I think are really smart. We were talking, so we provide social media content, but neither one of us really consume a lot of it, but I do listen to podcasts. So listening to Dr. Lyon, seeing her speak, reading studies that they talk about, listening to Peter Attia, reading studies he talks about. I just put my blinders on and I go, and I don't have time for anything else.
Yeah.
But anyway, the things that are so important, protein is super important, and everyone's talking about that a lot, thankfully. I'm pretty obsessive about that. At one point the kids were like, Mom, one of my sons, he was like, can you, because I feed everybody. I'm like, I cook a lot, but I'm really fast at it because I'm eating processed food. It's like, can we have at least 150 grams of protein every day? And I was like, oh, it was too much for me. But most of the time I get 100 or 120, whey, creatine.
Even aiming for that is, it's a lot. You have to really add in.
You can get used to it though.
Yeah.
I've come up with this
you probably have
shake.
a little routine.
I have a routine, and when I need to add more, I use naked whey, hemp seeds. I put whole body collagen with Fortibone, in it, if you're familiar with that. It's the one collagen that has some research on it for specifically osteopenia, which I hope I don't have, but I might. And I can get 45 grams of protein in this little, but I've added all the ingredients, and it's not something that's pre-made.
Yeah.
And knowing what nutrients you need really does require testing. So we are able to do, even using Quest and LabCorp, we put together blood lab panels that test all kinds of nutrients, including things that support mitochondria, like CoQ10, for example, is just one. And I also treat my perimenopause, and I'm happy I don't have to go to another doctor for that because it's really, it's too hard to go to appointments. The only people I see are my fascia therapists. I don't see any PTs right now. I know I'm a trainer. Exactly. So, and one day I'll go back to my spine doctor and be like, I'm doing amazing.
Yeah.
Thank you for.
I climbed this mountain.
Yes. Thank you for all your help along the way. Not afraid of medications, not afraid of prescription hormones, when needed. So my testosterone, from all of my sleepless nights from being OB was in that less than 3, and so I don't believe in the super physiologic treatment. I think it's very unsupported in the conventional medicine world. People hate that, but I do replace it back up to the normal range, which makes a difference for me. I don't love, people getting replaced super high. I think that's risky beyond what we know.
Just put yourself back where you need to be.
Just right back into the middle of the normal range. And one day I may not need it, if I get to have normal sleep patterns again. I'm not really sure. But replacing baby doses of estradiol and perimenopause is the newest way we're supposed to do it.
So
And
I've heard a lot about that in the last year, probably.
Yeah. Well, and finally, there's been people talking about it, and I've been doing that for years, actually.
Oh, okay.
But just last fall in the Green Journal, so our main OB-GYN journal, a new publication came out, Contemporary Review of Menopause Hormone Replacement Therapy, and they address all of that, best time to start is perimenopause and the safety of it, and debunking a lot of the WHI information.
Yeah. A lot of stuff that people are scared of.
I'm on call. Can I call you back? Is it an emergency? Okay, give me 2 minutes, okay? Okay, bye. Definitely not gonna ignore those. Where was I? Oh, and just like, so that supported, you know, that approach, and I was like, yay! I love it when I start doing something, and then some years later, I'm like, oh good, I made the right choice. You know? But so that's really, really important, because while muscles are helping us with our hormone regulation, especially the insulin, glucose, metabolism, cardiovascular things, all of that, whole body inflammation, you also do need like decent hormonal support. Certainly you can go through menopause and be totally fine without it, but when you're not, I definitely believe that it's okay to add that. And I've had to do that for myself, and that's what my lifestyle stress demands. And a lot of people do. I feel great, but I'm just very careful about the dosing, and that's what I do with patients. You know? I also like that, you know, being a gynecologist, when you take hormones, they affect your end organs, especially your reproductive organs. And so a lot of people get hormone replacement in a place where they aren't dealing with their end organ impact, and then it gets really confusing, because then they go to their doctors and they're like, why are you doing that? Why are you seeing those people? Well, like, because you wouldn't help me, and then it gets very confusing. The fascia health thing is super important, and I've had a lot of conversations with Susan, and then learning this, that like a lot of times I think with chronic pain that people can't figure out, that seems to
maybe
be
that could be the missing
a component of it. But yeah, I don't know how much you like have to get into that with people.
Not much, actually, and I haven't really done too, like I do soft tissue work, but the biggest kind of focus on your fascia health has been the cupping course that I took. So
which is utilized a lot for fascia. So anyway, the thing I do the worst with is this.
Oh, to sleep.
I would like to sleep, but it's like whenever you are an obstetrician or any other doctor that has to like suddenly, or anybody that has to suddenly wake up and be 100% on, like anything that happens.
Do you just sleep very light? Do you feel like you
I am the lightest sleeper.
Get deep sleep?
Like, I have a cold plunge in my bedroom now, so that's another thing I've gotten
in your bedroom
since I started. Well, I want it to be easy, right? I want like as least friction as possible. I've had an infrared sauna for a while, but it was in the attic. It's just like, you know, it's not. So we moved it into the bedroom, and then when I started strength training, and I was sore, and I was like taking ice baths, you know, and I hate to be cold. That's the other thing. But then I listened to the Comfort Crisis, and I was like, Betsy, like, get over it. Nobody wants to sit in ice. Like, nobody likes this, so you just do it. And you know, it doesn't feel good, but then you get out and you're like, yay, this is amazing. I never get sore. I don't get sore anymore. I mean, I'll be sore for like a day after I work out if he's like pushed me really hard. But then I'll get into the cold plunge the next day, and my soreness is gone, and I'm able to like roll into my new workout. So I bought a cold plunge because
from
it was
some
so
people
good.
That the cold plunge ice stuff isn't as good for women. I don't know if you've heard that.
I have, and so Dr. Lyon will debunk all of that stuff.
Okay.
She pretty much methodically.
Well, and then you have like firsthand experience with helping you.
Whenever you listen, I listen to very few people, medical people that I think are extremely smart and teaching the right things on podcasts. Like, I don't get on their social media because it like blows my mind to even look at that stuff. It like makes me anxious. But she methodically debunks all of that stuff of like, oh, this isn't good for women, or like how women train, you have to like do it with your cycle, or like living your life. And it's like me post call,
because then you would miss out on so much. You know, I can't do this week because
like wherever you are in your menstrual cycle.
What if you have a race planned and then it's, you know,
it's just your life, and you're gonna keep living it, and you can't time all that stuff. So it's like there doesn't need to be, those things don't need to be complicated. It's like when people get really obsessed about like, oh, well, like, when am I going to eat my protein? Or like all these details. Like, we just did our group.
Within so many minutes after.
And all things of nutrition. And we do these group visits to like teach people some of the core concepts that we want them to know, like in a more lengthy fashion. And we did the nutrition one yesterday, and it's like the first step is like eat enough protein in your day, eat your fruits and vegetables, whatever they are at first, just like eat some of them, you know?
You can simplify it.
You can like be really simple about it and then get more complicated, because 90% of your benefit is going to come from those like first most simple
and
like
just start
efforts.
somewhere.
But she debunked the cold plunge thing.
Okay.
She debunks all kinds of stuff as they pertain to like, oh, women can't or shouldn't.
Right.
Like she'll go through it with someone who's equally as intense and educated as herself, and they'll go through studies and like, you know, throw that out. But cold plunging is great. I do it, and I still get my cycle. Like my hormones are still cycling, even though I'm like doing these baby doses of perimenopause hormone support. And it never changes, you know. Like, so it's good. It builds your brown fat, increases your mitochondrial density, takes away soreness. So I do that. And
then you can get right back into your, you know,
into the strength training.
Your next session. You're not sore.
Delayed with it. So anyway, I don't know. Is there anything else that you want to throw in?
I don't think so. Yeah, just the main thing is that I've started doing this strength training program and getting a lot of patients from you. So thank you for that.
Yeah. Thank you for doing it.
Yeah.
Because I can't sit in. I still need someone to like hold my hand. You know, I certainly can't do it.
Yeah,
it takes like
good
a village
to have somebody.
of
And then I think
together.
a lot of people like the social aspect of it too. So there's, you know, usually 3 to 4 people working out together, and that helps too. You know, get to socialize
Be
also
less intimidating.
while you're working out.
Yeah. My other goal when I go in that gym is like, I'm gonna be a strong person one day. And I asked John, I was like, can I be a strong person one day? And he was like, give me like 3 years. And I was like, okay.
You're getting there though.
I'm gonna get there.
Look at where you were and then where you are now.
Yeah. So we want this for people in general. Like I see so many people walk into this office and feel just feel bad, you know, and most people walk in and say, I have a hormone problem, and I'm like, you do, but it's like a lot of other things happen too. It's like, you know, whole system, and you can never really fix it, like I said, coming after only one angle. But you know, I have found it working with women like for so many years. Everyone's really busy, but guys, I'm really busy too. Like I promise to God, it's like it is just so worth figuring out how to, you know, take care of your gut health, take care of your mitochondria, you know, circadian biology. Like I don't know if you get much into that. I have to, because I pull out all the stops for my sleep. I'm like
looking at the sun when
well, just like aligning yourself. Like I always walk and get outside. Even this morning, I'm on call. I come in at 7. I get my sign out. If I can run outside for 10 minutes and like look at the sky, the residents know that's what I'm doing. At night, I'm gonna be walking around the hospital with my blue blocker glasses on. Like everyone knows, because it helps me a little bit, you know. But you just get into the groove, and then once you start addressing all these parts of your life, it gets easier.
Yeah, and then you can't go without it, because you know how you're going to feel.
Without it, you feel good, you stay active, and like, I love how Peter Attia says, he's like, no one gets to the end of life and like wishes their bones were weaker, or wish they had less muscle, or wish they were moving less, or wish that they couldn't, you know, run around and play with their grandkids.
If we're gonna age, we might as well, you know, age well and feel good, and
or even if you're only 30, like a lot of 20 and 30-year-olds feel very bad too, because they're just not taking care of their mitochondria. They're not moving. They're not eating right. They're not understanding what's happening to their bodies hormonally. So this is really fun work. Like
it is. I love doing my little strength class and being a PT. So it is fun. Helping people move, and
you're gonna have to find other people that do this too.
I know, I do.
Because you're gonna get too busy. How many kids do you have?
I just have one.
How old is he?
He's 2.
Okay. You're like in toddler world.
Toddler world,
Yeah. So
well, he's sleeping, so that's good.
That is good. My boys were, whenever Benjamin was born, he was, that was when I first moved home. The twins were 13 months old, so they're like triplets. And then the last one was a surprise, and he was born like almost 3 years later. So they were always like this like little pile of boys, and
little
you know,
boys have fun.
It's amazing. But they train too. Like we were really,
and that y'all can do it together.
That. Yes, I can't keep up with them. Now they're like big muscular people, but I certainly am going to be able to keep up hiking and climbing mountains and all of that stuff.
And then one day with their kids, you know?
Yeah, I hope so. Are there any other questions you want to ask me? Or anything else you think we should talk about before we wrap up?
Goodness. I don't think so.
No, okay.
Off the top of my head, I don't have anything.
Yeah. Well,
Like we
thanks
covered a lot.
for hanging out with us today, and thanks for
Yeah.
talking with me on the video
Yeah.
so we can share
You're
with
welcome.
patients because I think people will get something out of it.
Yeah, for sure.
Yeah, thanks.
All right.